Hey everyone, Nicole here. I just wanted to do a little PSA about drug nutrient interactions and drug interactions. So I made a chart and I'm going to read from the chart if you're watching on video. That's why I'm not making eye contact. Sorry. This has been coming up so often. There's so many preventable issues. And it's so critical for health to understand what you're not being told when you're taking a drug. So I'm going to go over drug categories, their common names, and then nutrients that get depleted when people take these drugs for the most part. And there's not a lot of research on this because it's hard to study nutrient depletion specific to drugs when so many people are on all these different kinds of drugs. But we do know certain depletions do come from certain drug categories. So, for example, you've probably all heard of NSAIDs or non-steroidal anti-inflammatories. These are common over-the-counter drugs like aspirin that people usually take for arthritis or aches and pains. So the nutrients that get depleted with NSAIDs, regular use of NSAIDs, long-term use, are vitamin C and iron. And vitamin C is really important for collagen production and the immune system. So fending off against germs. And then iron is really important for oxygen delivery. So if you feel lightheaded or you get sick all the time, check to see what drugs you're taking. They might be causing nutrient depletions, even if you're eating foods that contain vitamin C and iron, or you're even taking multivitamins, it might not be enough. NSAIDs decrease vitamin C and iron. And then the next category is antihypertensives, diuretics, also called loop thiazide, antihypertensive, and diuretics that are potassium sparing. So these are also called water pills. You might know them as furosemide, bumetanide, or hydrochlorothiazide. And these treat hypertension or high blood pressure. So these types of medications, this drug category tends to cause nutrient depletions for calcium, magnesium, thiamine, zinc, potassium, and folate. Very important nutrients. Zinc you also need for immune system. Calcium you need for heart function, muscle function, bone strength, bone density. Folate you need for literally everything. If you don't have proper amounts of folate, you're just screwed. There's no other way to say it. The next category is antihypertensives, ACE inhibitors, or calcium channel blockers. These treat hypertension. So again, it's just a different type of drug category. They have a different metabolism and different function than the previous category I mentioned. So ACE inhibitors and calcium channel blockers deplete the nutrients zinc, potassium, iron, and folate. And again, this is with long-term use. Okay, so then statins, also, the technical term is hypercholesterolemics, but statins, they cause depletions in coenzyme Q10, vitamin D, and sorry, my chart is blocked. Vitamin E and beta carotene. So really important antioxidants for protecting the body from harm, oxidative stress. So you get oxidative stress from breathing in smoke if you live in the city or anywhere if you have a car or you're around cars. Just any air has toxins in it, so you need protection against that. And then vitamin D is in charge of all your hormones. So if you're getting depleted in vitamin D from your statins, that needs to be addressed immediately. And then hypoglycemic NSAIDs, Metformin is the most common brand name. I was actually just talking to a patient who was put on Metformin and did not have diabetes or prediabetes. So Metformin helps control blood sugar, but this patient was taking Synthroid for her hypothyroidism, and Metformin interacts with Synthroid. So she was actually getting really sick. It was not helping her control her blood sugar because she didn't need help controlling her blood sugar, and it was causing more problems. So that would be a drug-drug interaction. And then the nutrients that get depleted with drugs like metformin or other hypoglycemics or biguanides, those depletions would be vitamin B12, calcium, and vitamin D. So B12, super, super important for energy metabolism, cell proliferation, so many really important metabolic functions. It goes along with folate too. Really critical. You can also get an injection if you need to, which a lot of people do. The next category is corticosteroids. You might also know them as glucocorticoids with the oral route. And those deplete calcium, vitamin D, sodium, potassium, and chromium. Really, really important. And they can actually increase sodium and they decrease potassium. So I correct myself. They increase sodium and decrease potassium, which that in itself, sodium and potassium work together in a sodium-potassium channel pump. So having them go in the opposite direction is really damaging to the electrical current of the heart. And then the next category of drugs is antidepressants, also known as selective serotonin reuptake inhibitors, SSRIs. These increase folate and decrease calcium and vitamin D. Not good. So that needs to be addressed. That's a very commonly, these are all the most commonly prescribed medications, as well as the over-the-counter non-steroidal anti-inflammatory drugs. And then the next category is, and I'm going to stop here, oral contraceptives or birth control. So these affect estrogen and or progesterone to prevent unwanted pregnancy and manage menstrual cramps, and some people take it for skin issues. But they decrease vitamin B12, folate, I believe they increase calcium and then decrease magnesium. A lot of women cannot tolerate oral contraceptives, so they can get really depressed and just feel awful. And it can take a couple of months to figure this out or have these symptoms. But because they're depleting these nutrients, that in itself can cause depression and anxiety, which is totally preventable. And then last but not least, another drug interaction that's been coming up a lot lately is antibiotics interfere with oral contraceptives or birth control. So be careful with that. And then alcohol interferes with antibiotics. So if you know someone who's been in the hospital, in and out all the time, fighting infections, and they're drinking alcohol, or they have some kind of infection and they're not in the hospital, but it won't go away, find out if they're drinking alcohol, because that will cause so many problems that are preventable. And they'll probably get better really soon, as well as if their nutrition issues are addressed. Because if the nutrition issues are not addressed, then the wound won't heal, the infection won't go away, and you won't see your loved one coming home anytime soon. Or you might end up getting pregnant by accident because the oral contraceptives aren't working due to antibiotic use. So I've heard a lot of patients and friends and family members say, I've never heard of any of this. So hopefully you like this PSA. If you have any questions, head over to NicoleChenard.com. That's my website. Book a session with me. You can get a free 15-minute consult by booking on my website. It takes a couple of minutes, and see you soon. Thanks for listening.